back. As we get older, many of us battle knee pain. Sometimes it's so debilitating the doctors will recommend a total knee replacement. Well, as you're about to see, you might not have to settle for that diagnosis. I'm sitting here with Dr. Riggs, director of the Reflex Clinic in Portland, to talk about knee pain. First of all, let's talk about knee pain and why you became so interested in it.
Seeing many patients underserved in the current medical paradigm, getting caught between their diagnosis of arthritis and being told that they need their knee replaced. And there are many other options that patients aren't even aware of.
So what is osteoarthritis?
Simply put, it's loss of cartilage. And cartilage is an essential spongy tissue to help joints function properly. As we lose more and more cartilage, the joint doesn't properly function, leads to pain and disability.
Oftentimes that nagging is an indication that you're having some inflammation in your knee. So the sooner you come in, the better, because the faster we can actually evaluate your knee and see if you actually have arthritis or not. A lot of people have arthritis and they don't even know it. So if you were an avid athlete at a younger age, you may not have active knee pain, but if you were to get an x-ray and take a look, you might have arthritis, you just don't know it yet.
Well, I've been pretty active, competitive tennis player for a long time, and was really trying to increase my activity to get ready for tournament play, and it took me out of the game when I developed this OA in my left knee. I was really surprised because I'd had no problem whatsoever with my knees previous, and all of a sudden a change, and there it was. So it was kind of disheartening, right? Kind of disheartening because there was really nothing I could do about it. And so I found Reflex, and the rest is all a good story.
Can you tell me about the risk factors then for those who may develop OA?
Aging is a big risk factor. 60% of people age 60 and older will show signs of arthritis in their knees. Another one is genetics. Can't do much about that. And obesity. We are currently in an epidemic of obesity in our country, and that definitely plays a role. Another is injury. Kids are being pushed to participate in competitive sports at younger and younger ages. We're seeing more and more injuries, and half of knee injuries result in arthritis within 10 years.
And what can be done for these patients?
There are many advances being made. The amount of research being done in this field is astounding. Stem cell therapies are really advancing quickly. There's genetic engineering, and a new treatment, a Reflex we've just began to offer is PRP, which is platelet-rich plasma therapy. And several of our patients are having excellent results.
The way that PRP works is that we draw a little bit of the patient's blood, we spin it down so that we have just a liquid portion of their blood, their plasma, and that contains a lot of natural growth factors in it that help activate the healing cycle in your own body. And so we draw this fluid up, inject it into the joints, and that activates a healing process within your own body that's completely natural and it's completely mediated by your own body system.
And they just injected a little fluid into my knees, and gosh, when I came in, it was, I was having a hard time really playing at all because of the pain. Within 3.5 weeks, I would say 75%. Within a month and a half, I was 100%, and it's been just an increase from there.
We've had some dramatic results. Many of our patients have reported complete relief with these injections that allow them to go back to all the activities that they used to do and that they love. It's a really gratifying field of work to be in, especially when you see these kind of results.
The professionals here at Reflex, they understand how to get you from I'm broken to I'm fixed. That's good.
At Reflex, we've assembled a fantastic team, dedicated physicians and staff who are passionate about helping people get back to life, back to the activities they love. And we're really excited to get the word out. There is hope. There are alternatives to surgery.